Hi, I'm Charlie Talbot. I'm an orthopaedic surgeon with a specialist interest in shoulder and elbow surgery. I'd like to talk to you today a little bit about shoulder instability or shoulders that dislocate. So what is shoulder dislocation? Well, shoulder dislocation is when the ball dislocates or comes out of the socket of the shoulder itself. This can either be a subluxation, where the ball simply slips and slips back into place, or it can be a full dislocation, where the ball comes out of the socket and stays out and often needs to be put back in the emergency department. Why do we get shoulder instability? Well, there are different types of shoulder instability, and they're broadly separated into traumatic injuries or atraumatic injuries, in other words, no injury and no trauma. The classic dislocations we see are rugby players or skiers who fall heavily onto an outstretched arm and their shoulder pops out of joint. This often requires a trip to the emergency department to have the joint put back in under gas and air, or sometimes under anaesthetic in the operating theatre. In this situation, the structure or the internal structure of the shoulder can be damaged. The classic injury is a labral tear, which is a structure that goes around the socket that is a soft tissue enhancement of the socket to make it both wider and deeper and slightly more sucker-shaped. In addition to this, there can be bony injuries. The classic is something called a Hill-Sachs lesion, which is an impaction of the back of the ball of the shoulder on the front of the socket as it dislocates. And in addition to this, we sometimes see loss of bone at the front of the socket or little fractures that then mean that the socket is less conformed to the head, resulting in repeated dislocations of the shoulder. The younger patients are, when they first have a dislocation, very much correlates to their risk of having further dislocations. And therefore, the younger you are, the more active you are, the more likely that surgery may be required. The other group of patients we see are those patients who have laxity or stretchiness in their tissues that allows their shoulders either to pop or fully dislocate out due to their natural tissues and some of the ways in which the muscles are acting around the shoulder joint. The mainstay of treatment for these patients is going to be very much with physiotherapy and not surgery. So what happens if you need surgery to your shoulder for instability? When you come and see me, we do the clinical assessment, including examination, but often enhance this with imaging in the form of MRI or CT scans to give an indication of what injury or damage is done to the joint. This will then guide the treatment in terms of surgery. And in general terms, if there's a soft tissue injury, we do soft tissue repair. And if there is a bony injury, we do a bony operation to stabilize the shoulder. The most common surgery is day case keyhole surgery, which means coming into hospital for the day and allowing me to pop a camera into the shoulder while you're asleep to assess the structures fully and then repair the damaged labrum and possibly transfer a tendon into the back of the Hill-Sachs lesion, the damage at the back of the head, to provide repair both at the front and the back of the shoulder and prevent further dislocation. If you've had an injury to the bone around the socket, there's sometimes a need to do bony surgery, in which case we do bone transfer surgery to the front of the socket to stabilize the shoulder. This is something we can go through in detail in the clinic, and it's something that is individualized to each patient.